I call the member for Burdekin.
Thank you, Mr Deputy Speaker. Mr Deputy Speaker, we have a health crisis in the bush, and I don't say that lightly. A health crisis that revolves around attracting and retaining doctors. Would you say if I said that the Mackay Health Service had been advertising unsuccessfully for 4 years for a second doctor in Collinsville, or that Clermont was being serviced by locums because they can't attract a single permanent applicant? In short, Mr Deputy Speaker, the current system for recruiting medical practitioners and retaining them in rural communities is broken. And you live in a community such as Collinsville, Dysart, Clermont, you don't have the luxury of shopping around for a doctor. There is one doctor and that's it. If for any reason that doctor's tied up, if they're unable to fit you in because of their workload, if they're called away, then the only option is to drive to the nearest town and source another doctor. Now, in Clermont's case, that's a 200-kilometre round trip. I had an elderly resident ring me last month to advise that she needed to drive to Emerald to see a doctor because she couldn't get in to see her local doctor in Clermont. Now, this elderly lady has not driven out of Clermont for some 15 years. And here she was undertaking a 200-kilometre round trip, running the gauntlet of road trains, kangaroos, highway traffic. It's not good enough. And I certainly hope that it is not going to take a death before this government acts on this issue. I've spoken to the Queensland Health Minister, I've written to the Federal Health Minister as well. There's no question in my mind that this is an issue that will require a commitment from all levels of government, medical schools and colleges. There's no easy fix to this problem. However, I would like to think that we live in a first world country, not a third world country, where access to basic medical services should be the norm, not the exception. I'm passionate about attracting people back to the bush, but that task is made so much harder if our rural communities are unable to provide basic services such as health and education. This is a serious problem, Mr Deputy Speaker, that needs to be addressed as a matter of urgency, and I will continue to fight to have this system overhauled so that country people have access to the same basic health services as their city cousins. Mr Deputy Speaker, when you go to these communities and you see the growth, particularly in our mining towns, there is a need to have medical practitioners based in those communities, not only as a service to the local community, but also to be there in case of an emergency. We've had a number of fatalities in the resource sector in recent months, which highlights the importance of having medical practitioners available 24 hours a day, 7 days a week. This is a serious issue, and I'm not about to give up this fight to have this matter addressed.